It is a feel-good Friday, Shawn and Sue, and we are joined today by Dr. Merritt Brown, Interventional Neurologist, Neurological Medical Director of the Neurovascular Program at CMC Community Medical Center and Assistant Professor, Department of Neurosurgery with RWJMS. Doctor, thanks for being with us.
Thanks so much for having me.
Good morning, Dr. Brown. Happy Friday. We have a couple questions for you. Welcome to the show.
Thank you so much.
What should the average person know, basically, when they're recognizing the signs of a stroke quickly?
One of the things in terms of recognizing a stroke is, just like you said, be as quick as possible in having any type of an inkling of thought that somebody is having a stroke. There's an acronym that we use. It's called BFAST, B-E-F-A-S-T, and the letters for that stand for a number of things that you look for as a sign of somebody having a stroke. The B is for balance. If somebody is starting to feel off balance or they're becoming discoordinated, if they all of a sudden have blurred or double vision, or they lose vision to either one side of their body or lose vision in one eye. The F is for face. If they start noticing that they're drooping on one side of the face, or they're having difficulty smiling, or it sounds like they're really slurring their words. The A is for arm, but really what it comes down to is if somebody becomes weak or has a real heaviness on one side, specifically one arm or the arm and the leg. If they have numbness in the arm or the leg, that's another thing to look for. The S is again for speech, not only in terms of slurring your speech, but also being able to either produce speech or understand what others are trying to say to them. And then the T is really two different things. The T is really for time, because time is of the essence when somebody starts to have these problems, because getting to a hospital and getting care is really paramount. And then T also really stands for something that is called a thunderclap headache. Like all of a sudden you have a headache that feels like it is the worst pain, and it just comes out of the blue and it hits you as hard as you could imagine. All of those things are reasons to be able to call 911, to activate emergency medical services, and get to the hospital as quickly as possible.
When it comes to stroke, doctor, why is time such an important factor?
Because as soon as you have what is called an ischemic stroke, where a blood vessel is blocked off, so you're not getting blood, you're not getting oxygen and nutrients to parts of your brain, the clock starts, and you are in a situation that for every minute that goes by, you can lose up to 2 million brain cells, which means that over the course of, you say, an average 10-minute to 20-minute to 30-minute stroke, you're losing tens of millions of brain cells. That can result in permanent disability. Time is really of the essence, because getting to the hospital in a reasonable time and as quickly as possible really gives us the opportunity to use certain medications that are clot-busting medications that could potentially break down the blood clot to be able to restore blood flow, restore oxygen and nutrients to the brain and have it work again. And we can also potentially end up doing procedures to be able to take blood clots out, to be able to do those same things. But really, time is of the essence, because once the damage has been done, it doesn't end up growing, you don't end up growing brain tissue back. So some of that disability could potentially be permanent.
All right, so Shawn and Sue here talking to Dr. Brown, Interventional Neurologist at Community Medical Center. What are some of the most exciting advancements, doctor, in interventional neurology right now?
Interventional neurology and interventional neurosurgery really has taken a quantum leap over the course of the last 10 years. We have seen a lot of new players come to this field just by nature of the fact that we are capable of doing so many more things. We're able to manage patients that have really significant disability, things that are like stroke, things that are like having aneurysms rupture, and being able to care for those patients by shutting their aneurysms down, potentially treating people because of malformations that weren't originally able to be taken care of by actually injecting what is the equivalent of a gluey substance into those vessels to be able to shut down the ones that bleed. We can also treat things that are not as urgent. So people that have certain types of headache disorders can actually be managed either by us giving medications to be able to numb that headache out, or potentially even do things like stent certain arteries that are implicated in causing headaches. So a lot of different opportunities. Also, the number of players, as I mentioned, to the field, the number of different developers that are coming up with new equipment basically increases every year, and all of the equipment that we have make these procedures safer and more likely to result in a good outcome.
Real quick, as we wrap up, lifestyle choices. What can we do to get a better chance of not having a stroke?
The biggest pieces are what we call the reversible cerebrovascular risk factors. There's some things in life that we unfortunately can't change. Age is one of them. As we all get older, we are at a higher risk of having a stroke or some type of a bleed or cardiovascular incident, heart attacks, things like that. But there's also those reversible risk factors, things like people that are not controlling their high blood pressure, controlling the amount of cholesterol that they have, and the amount of blood sugar abnormalities. If they have diabetes, whether or not their blood sugar is really going off of the charts. The biggest piece that we also see, which unfortunately our community has a number of people, are tobacco users. Tobacco is something that absolutely destroys the vessels, and it increases the risk of you having either a heart attack or a stroke substantially. So as much as possible, being able to quit smoking, being able to control your high blood pressure, being able to make sure that you're eating a reasonable diet and getting some exercise, being able to take medications that control your diabetes or control your cholesterol. All of those things make the likelihood of you having a stroke drop back to that of the general population.
Dr. Merritt Brown, thanks so much for being with us today.
Thank you so much
Thanks,
for the
Doctor.
opportunity.
Great meeting you.
If you'd like more
Meeting as well.
information, go to rwjbh.org for details.